Hello, everyone. My name is Dr. Sue Paul. I'm the Senior Director of Wellbeing and Brain Health for Asbury Communities. Welcome to this month's Ask Asbury. May is Bone Health and Osteoporosis Awareness Month. And today we're here with Jamala Baghtani. She is a physical therapist at Asbury Methodist Village. So welcome, Jamala. So great to
Hello,
have you.
everyone. Hello, thank you, Dr. Sue, for having me here and giving me the opportunity to speak about bone health and osteoporosis. So a little bit about me. I'm Jamala Baghtani. I'm the physical therapist and the director of rehab at Asbury Outpatient Therapy Services. I have been with Asbury for last 10 years and working with all our residents and geriatric clients. So osteoporosis and bone health is a very common condition we encounter, and it's my pleasure to speak to all of you about this.
Oh, thank you so much for being here. We really look forward to your expertise on this subject matter. It does seem to affect a lot of people at some point. So let's start with the basics. So what is osteoporosis and why do they call it the silent disease?
Okay. So osteoporosis, in a simple term, is a bone disease where the bone loses too much bone mass, or body doesn't make the bone enough to make the bone mass, or combination of both. So either your bone is too weak or brittle because bone is losing the mass, or body is not making enough. So in a simple term, that's what the osteoporosis is. Osteoporosis has the term porous in it, and the bone is becoming porous, like it's very fragile and brittle. So that's osteoporosis. It's a common condition which is very, like, the big problem. It's called a silent killer or silent disease because there are no obvious signs associated with it. Nobody knows if their bones are getting weak. There is no way to know the bones are getting weak or fragile. Only way they know is once they encounter an injury or a fracture or chronic pain. So that's why the silent killer or silent disease, because it is very hard to diagnose the weak bone unless there is a routine scanning or, bone study or DEXA scanning done.
Mm-hmm.
So there are no obvious sign associated with osteoporosis, and that's why it most of the time gets undiagnosed unless someone encounter a big fracture, and that's too late to find it out.
Yeah, and they might say, "Wow, I didn't even fall that hard, and my
Exactly.
broke my wrist when I fell. Like, how did that happen?"
Yeah.
Yeah,
So
pretty common.
that's pretty common, but often goes undiagnosed. But
Yeah.
awareness is increasing, so I think physicians are being proactive, scanning people who are more susceptible to have osteoporosis, especially females, postmenopausal. So
Yeah.
if your physician is not doing scanning for you, you can say, hey, could you scan me? Do I have osteoporosis?
So that's a great segue into my next question. So how can physical therapy prevent or manage osteoporosis?
So physical therapy is one of the most effective proven treatment for osteoporosis. Physical therapy guided exercises and home exercise regimen can improve the bone health by incorporating weight-bearing exercises, by improving the muscle strength, working on improving the posture, and also strong muscles, improving balance would actually reduce the likelihood of falls. So physical therapy is actually a very effective proven treatment. Your exercise plan has to be established by a qualified physical therapist who has worked with osteoporotic condition, but it really promotes all this, which I say, bone density, stronger muscles, balance, improve the posture, and improves flexibility.
But Jamala, you said something about the exercise. I'd like to dive deep on real quick because you said about weight bearing. How does weight bearing improve bone strength? Now, why is that so important?
So weight bearing exercises put stress on your bone. It loads the bone, and loading of the bone actually increases the bone mass and bone density. So loading and weight bearing especially is very important because you're working against the gravity. The bone is being stressed upon, and that helps build the bone mass. So it's a weight-bearing exercises are very, very important in terms of all the therapeutic exercises for
Yeah,
osteoporosis.
I think a lot of people know, like they know that calcium and vitamin D are important for bone health, but there's certain movement patterns and certain kinds of exercises that actually have a lot of impact. Because if you're a person you can't just take your vitamin D and your calcium and sit in a chair, you have to do certain things. So like, what sort of things can somebody do to?
So, of course, as I did say, weight-bearing exercises, regular walking, hiking, that also, adds the positive stress to the bone. And progressive resistive exercises like muscle strengthening, because stronger muscles also load the bone. So that actually enhances the bone health. So that also is a good exercise, resistive exercise. So weight bearing and resistive exercises are big component, which should be included in the exercise regimen. Along with that, I also want to talk about balance exercises because balance plays a very crucial role. Again, your role. You're loading your joints, you're standing, you're practicing balance. That actually reduces the fall risk and improves the strength in your ankle, your feet, muscles, and your proprioceptors get stimulated. So all that enhances the coordination balance and in turn reduces the fall risk. So balance exercises also are a crucial component for osteoporotic exercises.
That's really interesting. It's something you don't think about really, but it's all related, right? Like it's all how the human skeleton was designed to move and be loaded. Are there any misconceptions that people have about exercise and osteoporosis? And
a lot of people think that, oh, I have osteoporosis, so I should move less. No, moving less will be like actually making your bone even more brittle. You will be even more at the risk of falling. Less movement, less strength. You try to move anytime, you would end up having a fall or injury. So movement is the key. And another misconception, I think, people think that, oh, I can just take calcium and vitamin D and my bones will be strong. No, you need to load the bone. You need to add that stress to the bone so that they can increase the bone mass. Of course, nutrition is important, but loading the bone and exercise are big priority.
Yeah, that's huge. I think a lot of people, these kind of tips that you're suggesting are good for you whether you have osteoporosis or not.
That's correct.
Like, it's preventative for bone loss, but it's also preventative for muscle loss and for falls. And it's just such common sense, right? Like these are things.
Yes.
I find like the resistance sometimes to doing heavy or hard things, especially in the older population, because they feel like they're too frail to do those sort of things, or it's too risky. It's just like kind of counterintuitive to what they actually should be doing.
Correct. So a lot of people think, oh, because I have osteoporosis, I should not do weight. I should do only gentle activities. Yes, the weight training is very much required. And of course, that's where the therapists play a role. They will develop a program for you, like a person specific. They're not going to load you to the resistance where you cannot take it. But of course, you need the resistance. Of course, you need to create that stress to your muscles and your joints and your bones so that you can improve the bone mass or at least maintain it so that you're not at the risk of falling.
So what would be 3 exercises that you would recommend everybody should do?
Aerobic weight-bearing exercises, which is walking.
Like brisk walking or slow walking, or does it matter?
Up to patient's tolerance. They can do brisk walking. They can do moderate walking. No running. I'm not saying run, but brisk walking or whatever intensity they can tolerate. So, and then strength exercises. That can be their own body weight. That can be the outside resistance and balance exercises. I think those 3 exercises everyone should do. So aerobic exercise, strength exercise, and the balance. Okay.
That's pretty common advice.
Yeah. And it's common. And I'm sure a lot of people are already doing it. Right. But important and it is helpful.
So if someone got diagnosed just recently with osteoporosis, what's the first thing you'd tell them to do?
So I would tell them understand the diagnosis. Don't be
Mm-hmm.
scared of it. It's manageable, it's preventable. Then consult a physical therapist. Develop your own exercise program. Understand how the exercise is going to help you. That's they can develop a personalized plan for the person and get your posture evaluated, have an ergonomics evaluation because stooping posture and also forward leaning posture, repetitive flexion can lead to compression fracture if the bones are osteoporotic. So have physical therapists involved, have some lifestyle modification, avoid smoking and alcohol because intake of alcohol and smoking are associated with increased bone loss. So if you are diagnosed with osteoporosis, you want to consider having some lifestyle modification. And another thing is prioritize the nutrition. Calcium and vitamin D is important component for osteoporosis. So you want to have not only calcium and vitamin D, but protein as well. So watch your intake and have, if you need vitamin D supplement, take it. Calcium sources like milk, yogurt, include that in your diet. And then regular checkup and follow up with your MD. Keep and watch on your osteoporosis if it's progressing and if it's maintaining. So I would suggest that.
Something that I think, especially women over the age of 50, who aren't even diagnosed yet with osteoporosis, but maybe have osteopenia, which is just loss of bone cells, which is sort of a precursor to, or it can lead to osteoporosis. So all of these same tips apply to someone not yet diagnosed with osteoporosis, but might be experiencing just some age-related bone loss. It's really important that because you can reverse it to some extent, right? You can build up your bones so that you're at less risk for fracture and less risk for increased bone loss.
Correct. So absolutely.
Super important.
Absolutely. In fact, for women who are in premenopausal state, they know they will experience because of the lack of hormone. Females are more susceptible to have osteoporosis. So it's a good idea to start doing the resistive exercises, weight bearing, walking, hiking, stair climbing, because ultimately we are in charge of our own health. And don't let the condition progress to an extent where you are struggling after having a fracture you are working on preventing. I think earlier they start exercise, and that actually goes for not only for female but for male also. Aging male also are prone to osteoporosis. So start doing the weight bearing exercises. And I think because walking, hiking is common, a lot of people do it naturally. I think resistive exercises are kind of taken back spot. People are afraid they are osteoporosis, so that's why I'm emphasizing more on doing that resistive exercises. It could be just your own body weight resistance, doing the squats, doing the push-ups, doing the lunges, your own body weight. You're not using outside resistance, but it's loading your bone, it's loading your muscles, helps to build the bone mass.
Right. Well, Jamala, thank you so much for all this information. As somebody who's over the age of 50, and, I just had a routine DEXA scan that my doctor suggested and came up osteopenic. Oh boy, I want to get on top of that, as soon as I can. So, I wear a weighted vest around my house doing my chores. I do a lot of jumping and hopping sort of activities to help load that bone even more. I just want to do everything I can to continue to age with healthy bones and not, get them weaker and weaker. It's really hard to heal an osteoporotic bone also.
Also, yes,
so
absolutely.
The healthier the bone, if you do break it, the better the healing is. So, if it's going to go that way, then we want, to make sure that the healing at least is easier.
Yes, that's very good. And weighted vests are the way to go. It's really
weighted vests are great.
It's very, very good invention, whoever did it or whoever found that out, because it really is an effective way. You're walking around the home, might as well load the body and load the bone a little bit.
For those of you listening, you can go on Amazon and get a weighted vest. Like they come in like from 6 to 15 pounds. I
Yeah.
think I think 10 is even a lot.
Yeah.
But you put this vest on, and it just gives you a little bit of, spinal stimulation, and your lower legs get that stimulation because it's just a little bit of added weight. And you just put it on to tolerance. You don't want to walk around until you're getting sore and achy from it, but just incorporating that extra resistance and bone is really an easy way to get.
That's
And if you want to
that's
go off
correct.
the vest on, even
That's correct. And as I said, everyone has to come up to their level.
uh-huh.
Somebody might start with 4 pound first and then gradually build themselves up. And
Yep.
so everyone is different. You need a personalized exercise plan and personalized way to address this
Right.
osteoporosis.
So go see your physical therapist.
Go see a
Right
physical
off the bat,
therapist.
and get set up on your exercise program that will help you, come up with exactly what's right for you. Because there is some risk, and there's a little bit of scare, like you are scared to do too much or what's going to hurt me. So it's good to have a therapist evaluate you and know and advise you exactly to your needs, what the best exercise program would be for you.
Correct. And in addition, physical therapists also can identify the movement you're doing every day, like a computer worker, what movement they are doing, like a housewife
A
who is
great point.
bending repetitively, not realizing that bending is causing so much problem for her, reaching overhead. Some people get out of the bed in a very weird way. So physical therapists can evaluate those movements because those repetitive small movements,
Mhm.
you would not realize they can also cause a lot of problem and compression fractures because the bones are osteoporotic. So
Right.
yes, please see your therapist and they can develop a personalized plan for you.
Yep. Okay. Well, thank you, Jamala. I want everybody listening to take care of their bones because it's really who you are. You're this whole skeleton. You are bones. Like your whole skeleton needs the attention, and it's not to be, put off. You got to get on your bone health right away. So thank you again, Jamala, and thank you everybody who's watching. And we'll see you next month.